Senator Muir.
Thank you, Mr Acting Deputy President. Due to the nature and confusion in the Senate in the lead-up to this sitting period, there was uncertainty as to whether this bill was going to have an opportunity to be debated or not. So I'd like to thank the Chamber for the opportunity and, of course, my parliamentary colleagues to present my second reading speech today. Some would say, why would the representative of the Australian Motoring Enthusiast Party be debating a bill in relation to type 1 diabetes? Well, the party name may be a single-issue party name, but we are all too aware that this position and my role comes with the responsibility to all Australians. This is an important issue, and I'm proud to be the one to bring it front and centre in Parliament and for it to be debated, hopefully, quite thoroughly. Type 1 diabetes directly affects over 120,000 people in Australia alone, some of which work right here in Parliament House. I would like to note that type 1 diabetes is an autoimmune condition which is a non-choice disease that lasts for life. The Social Security Amendment Diabetes Support Bill 2016 I present to the Senate today will ease the impact of diabetes on individuals affected by the disease. The purpose of the Social Security Amendment Diabetes Support Bill 2016 is to amend the Social Security Act 1991 to give individuals diagnosed with type 1 diabetes access to the required medication and peripheral devices that the disease imposes upon the individual regardless of their geographic location or social status. Type 1 diabetes is a form of diabetes marked by a complete lack of insulin. Therefore, insulin replacement is required for survival. Type 1 diabetes can create a significant financial and emotional burden to its patients, family and the community. Differing social statuses can result in an unintended disregard of an individual's care plan, leading to higher risk of complications requiring hospital admissions and can, as a result, impose a significant burden on the taxpayer. The more time people with type 1 diabetes spend outside the normal range of blood glucose levels, the greater risk of serious health complications. Currently, the cost of hospital-admitted patient services as a result of diabetes diagnosed admittance is equal to expenditure on blood glucose-lowering medications. This level of hospital admittance is a completely unnecessary burden on the taxpayer, which could potentially be reduced should this bill be supported. This bill ensures access to medication and peripheral devices required by individuals diagnosed with type 1 diabetes are accessible despite their socio-economic status. I was approached by Dr Peter Goss of Gippsland Paediatric Diabetes Unit, Sale, in my electorate of Victoria in October 2014. Dr Peter Goss requested that I advocate for the age group of 18 to 25-year-olds diagnosed with type 1 diabetes, at the time citing that 18 to 25-year-old age group with type 1 diabetes has the highest rate of death in diabetes. With such a substantial number of Australians being directly and indirectly affected by type 1 diabetes, this was something I was more than happy to discuss and discuss further and support unconditionally. Type 1 diabetes is an unwelcome and unwanted intruder in the life of an individual and their family. It's an autoimmune disease that cannot be prevented or cured. Before the discovery of insulin in the 1920s, type 1 diabetes was a fatal condition. Although type 1 diabetes is now manageable, it places an enormous burden on families by requiring them to enter a daily and relentless grind of blood testing and insulin injections. There is solid evidence that the peak risk of poor control and death in type 1 diabetes is between ages 16 and 25. Currently, a child with type 1 diabetes often loses their healthcare card at 16 years of age, imposing a significant financial burden on the person with type 1 diabetes as they enter their most vulnerable period of life. There is anecdotal evidence that young people are also more likely to skimp on the essentials of diabetes care, such as insulin scripts, glucagon strips, blood glucose, blood ketones, and test strips. Blood ketone test strips, insulin pump consumables, and even quality food because of the cost. This lack of attention to scripts, doctor's visits, diabetes education visits, and devices due to lack of financial assistance can create long-term complications and possible hospital admissions, which impose a significant health and financial burden on not only the individual but the community. Given that type 1 diabetes is a lifelong autoimmune disease, It is not unreasonable to not only try to ease the pressure on such a high-risk demographic, but make available to all those at risk a healthcare card to assist sufferers of type 1 diabetes in accessing the medical and peripheral devices required. On August 20, 2015, I moved a motion in the Senate in relation to type 1 diabetes. The text was as follows: that the Senate notes that 1. Type 1 diabetes mellitus is an autoimmune, not lifestyle condition which affects over 120,000 Australians. 2. People diagnosed with type 1 diabetes require insulin to manage their diabetes for life. 3. Type 1 diabetes is one of the most common chronic diseases affecting children in Australia. And 4. Type 1 diabetes creates a significant financial and emotional burden for its patients, family and the community, and acknowledges the importance of access to optimal medical management for people with type 1 diabetes regardless of geographical location or social status. This motion was passed in the Senate unopposed. In addition to this, I note that the Australian National Diabetes Strategy 2016 to 2020, which was released to supersede the National Diabetes Strategy 2000 to 2004, was endorsed by the Australian Health Ministers Advisory Council on the 2nd of October 2015, noted by the COAG Health Council on 6th of November 2015, and publicly released on the 13th of November 2015. So since I moved my motion, I am pleased to note that the Australian Government has developed a new national diabetes strategy to update and prioritise the national response to diabetes across all levels of government. I appreciate that there are current government initiatives in place, in addition to the recently developed Australian National Diabetes Strategy 2016 to 2020, such as the National Diabetes Service Scheme and Chronic Disease Management Assistance to assist individuals. I strongly believe that the Social Security Amendment Diabetes Support Bill 2016 can work in collaboration with the key government initiatives which are essential for individuals diagnosed with type 1 diabetes. I also believe that the Social Security Amendment Diabetes Support Bill can support some of the key purposes outlined in the Australian National Diabetes Strategy. The purpose of the Australian National Diabetes Strategy 2016 to 2020 is to prioritise Australia's response to diabetes and identify approaches to reducing the impact of diabetes in the community. It recognises the social and economic burden of the disease and provides action areas that prevent, detect and manage diabetes, improve diabetes services and care, recognises the different roles and responsibilities of all levels of government and the non-government sector, promote coordination of health resources across all levels of government, facilitate coordinated, integrated and multidisciplinary care, improve use of primary care services and increase recognition of patients' needs across a continuum of care. More specifically, the Australian National Diabetes Strategy 2016 to 2020 Goal 3 aims to reduce the occurrence of diabetes-related complications and improve quality of life among people with diabetes. The potential areas for action addressed with this goal are: develop nationally agreed clinical guidelines, local care pathways and complications prevention programs, expand consumer engagement and self-management, develop and implement quality improvement processes, use information and communication technology, improve affordability access to medicines and devices, improve workforce capacity, improve funding mechanisms, provide mental health care for people with diabetes, strengthen and expand transition from child to adult services, make preschool, school and childcare diabetes safe environments, and provide high-quality hospital care. Many of these potential areas for action can be addressed directly and indirectly through the support for this bill. More specifically, optimal diabetes care for children or adolescents in school is crucial to achieve the best possible diabetes control and to prevent any present or future risk of harm to their health and well-being. This will give affected children and adolescents the best opportunity to concentrate, participate and learn whilst at school. Children with type 1 diabetes should have the same educational and social opportunities as children without diabetes. Every child has the right to participate equally in school activities, including outdoor activities and sponsored events away from schools to receive support for diabetes care. Ensuring the implementation of accessibility to diabetes care from a younger age will carry over into better diabetes care and practices into adolescence and adulthood. In closing, I would like to readdress the importance of awareness surrounding type 1 diabetes. Not one person who has type 1 diabetes has a choice in their diagnosis. It cannot be prevented nor cured. Type 1 diabetes creates a significant financial and emotional burden to its patients, family and the community. This bill will ensure medication and peripheral devices that are required by individuals diagnosed with type 1 diabetes can be accessed regardless of one's socio-economic status. If we are anyway serious about improving the quality of life of people with type 1 diabetes, I suggest all senators support this bill. But I'd also like this opportunity to inform the Senate that since I introduced the Social Security Amendment Diabetes Support Bill 2016, I've received copious amounts of correspondence and support. It is moving that so many people have taken this opportunity to reach out to me, sharing their personal accounts of the highs and lows associated with the burden that comes with being diagnosed with type 1 diabetes. These often saddening accounts have not only come from the individual which is being diagnosed, but also their loved ones. The parents, which have to care for the child, knowing that every decision they make will affect the future health of the life they created. The brothers and sisters, which have to accept a feeling of helplessness when their siblings may not have the same support and health care as themselves for a disease which is not their fault. The extended family members and friends who can do nothing but sit back and watch loved ones doing all they can in an often disheartening battle. I would like to share a couple of these messages from individuals which have made contact with me. Kyla sent to me on Tuesday the 8th of March. Dear Mr Muir, thank you so much for addressing this vitally important issue. My son was diagnosed with this horrific chronic disease a week after his 2nd birthday. It has changed our life in every conceivable way. There are of course the numerous finger pricks, insulin injections, set changes, the weight and calculating of every gram of carbohydrate, fat and protein of every mouthful of food that passes his lips, the never-ending night checks and constant zombie state of sustained sleep deprivation, and the unneeding worrying about how every bit of exercise or play, even a common cold, will affect his blood sugar levels. There's a largely unspoken detrimental effect on partnerships and family relationships. The constant stress and fear of your child not waking up alive, or the fear that every day, childhood occasions like birthdays, sleepovers, and even just being away from you at school. There is also a huge financial burden, even with the healthcare card. And all of this just from a parent's point of view. My little boy will have to deal with this for the rest of his life. There is no way this disease was his fault. As you know, type 1 diabetes is not caused by eating too much sugar or not exercising enough. This is a life-threatening autoimmune disease. He will have so much to deal with every hour, every day, forever. And that's not counting any of the other everyday stuff. Please, at least continue to allow him and every other person with type 1 diabetes fight this ongoing battle with the subsidised medical necessities they need throughout their lives. Yours in hope, Kyla. Juanita sent to me on Wednesday, the 9th of March. I'd like to see all type 1 diabetics be included in this bill. As a type 1 diabetic, the costs associated with this disease are high. It becomes a financial juggling act with the questions: do I buy diabetes medication or peripherals, or do I buy food this week? The costs associated with type 1 diabetes are often subsidised. However, even with these subsidies, it is expensive, and often we have to go without necessary medications, insulins, test strips and other peripherals simply because we cannot afford them. My council has taken away all public sharps containers and now costs $22 for every 2.5 kilogram container, $7.50 per container as well. So that's around $30 per disposal. And that's just the cost of the test strips, machines, insulins, etc. each week, and that's before you even think about buying healthy foods such as fresh produce. We as type 1 diabetics get 5 free visits per year from the government. However, diabetes educator, dietitian, exercise physiologist, podiatrist and optometrist visits. That is just one visit each per year, and I've had several visits alone. Just with the diabetes educator in these past few months, that means no dietitian, podiatrist, optometrist or exercise physiologist for me for another year. And if I need to see my diabetes educator again, it will cost me around $70 per visit. I can't afford that. Type 1 diabetes is not a lifestyle disease. It is not something I bought on myself, and it's hard enough to live with without the cost associated with trying to maintain it to optimum levels. It ends up being a choice between, do I want to keep my blood sugars under control or do I want to eat this week? Each week I have to decide which diabetes product I need the most. Test strips or insulin, glycogen, glucose, hyposnacks. If I had a healthcare card, I could afford to do what I'm supposed to do with medications, etc., and thereby easing the burden on the healthcare system in the future. Unless there are changes to all healthcare cards, I'm a statistic waiting to happen. Will it be kidney failure and dialysis, or perhaps heart disease, amputation of limbs? The list goes on. Give all type 1 diabetics a permanent healthcare card. It will be cheaper in the long term. Juanita. This is just a tip of the iceberg. Not one individual situation is the same. A doctor cannot simply look at an individual diagnosed with type 1 diabetes and say, OK, you have diabetes, take this medication. The healthcare plan required by each and every person diagnosed with type 1 diabetes is individually tailored to them by a team of healthcare professionals, including but not limited to endocrinologist, diabetes educator and dietitian. I would also like to address some questions I have received from individuals in relation to my introduction of this bill. As mentioned earlier, in my second reading speech, this healthcare card would only be applicable to individuals who are diagnosed with type 1 diabetes. This is due to the fact that type 1 diabetes is a non-lifestyle disease. There is no prevention for type 1 diabetes. There is no cure for type 1 diabetes. Unlike other forms of diabetes, there is no alternative to insulin injections for life. For the individuals who fall into this category. As a nation, we need to be looking at preventative health. By assisting individuals diagnosed with type 1 diabetes to maintain optimal health, this could significantly reduce the future health costs associated with disabilities derived from diabetes-related complications. If there is an opportunity to ease the emotional and financial burden on individuals and families affected by type 1 diabetes, why would it not be considered? If there is the opportunity to make diabetes control more accessible to people diagnosed with type 1 diabetes, preventing permanent damage, why would it not be considered? This is a first step in a preventative health approach, setting a positive precedent for the future of Australian health. Thank you.
Thank you, Senator.